Welcome to the lecture on creating goals and objectives. The focus of this lesson will be to review goals and objectives and to help you prepare to begin writing objectives for the health fair. I always like to compare planning a trip to planning a program. So when I ask you, when you go on a trip, what is the first thing you decide? Most of you will answer where you're going. And then you decide more specific details. And that's exactly how we plan programming. The first thing we decide is where are we going? We know for us that we're having a health fair. We need to know where, when, why, and how. The goals help us focus on the larger picture or the outcomes. So the question becomes, where do we get our goals? Do we make them up ourselves? We sit down and decide what we want our goals to be? And the answer is no. Usually you will be getting your goals from a national source. For this class, we will be using Healthy People 2020, and as you begin to go to the links I provide you, you will see that they are now working on Healthy People 2030. In case you've forgotten, Healthy People is a set of goals or outcomes established by the federal government and health organizations within the government and private organizations outside the government. They look at all of our health data for the United States and they develop criteria and focus areas for us for the next 10 years. So the links I provide you will get you to Healthy People 2020 information, but you will also see there that there's Healthy People 2030 data beginning to be collected. The other source, because we're working with youth, is the YRBSS, which is the Youth Risk Behavior Surveillance Survey. That's given every year in school systems throughout the country. These are national sources, and they tell us where we are going, and they tell us what the goals are or what the outcomes are. So to review what goals are broad statements of direction. They're used to present the overall intent of a program or course. So they're very broad statements. These are some examples of goals. Participants will understand the importance of eating healthy meals. The use of non-prescription drugs will reduce. Students will understand the digestion process. Students will show an appreciation for exercise. These are very broad statements. These are some words that are used when you're writing goals. These are not all the words, but these are some of the words. Because goals are very broad statements, we have to move from goals to objectives. And so while goals provide us a sense of where we want to go, they do not provide us clear, precise statements of our destination. Objectives are much more specific, and they give us concrete strategies for measurement and assessment. So they tell us what we're going to do, usually how we're going to do it, and they tell us how we're going to measure or assess success. So where do we get our objectives? Our objectives do not typically come from national sources. Typically, we create our own objective with the needs assessment data we have. For this health fair, we are using both primary and secondary data, which is true of most programs you will plan, and we're basing them on the national goals that we use. So you're going to look at the national goals that we have, and you're going to look at our primary and secondary data from the needs assessment, and based on that information, you will be creating objectives for the health fair. So just to review, objectives are specific and they answer who, what, when, where, and how. They are measurable. Or we also talk about them being SMART. SMART objectives are specific, measurable, achievable, relevant, and timely. And you'll practice some of this during class. These are the kind of words that you use with objectives, and they're different than words with goals because all of these words can be measured. They're more specific and they are measurable. These are other words that you can use with objectives. There will be information in Blackboard on Bloom's taxonomy and many more verbs for you to look at and consider using. So this is the chart that you're going to be using. It should look very similar to the chart that you used in Health 315, because in reality, all planning is done in a very similar way. It doesn't matter what you're planning. Typically, the planning process is very similar. So in this class, you're going to find a national goal or goals that relate to what you're doing. You have national data on education in schools. You have national data on health behavior and health goals. You're going to list your national goal or goals, and then you're going to switch that over to a community goal. What specifically does that mean for your community, which is our middle school in this case? Then we're going to start with writing objectives. Your objectives we'll start writing in class, and you will be submitting them for approval. So that concludes the lecture on goals and objectives. It should have helped you review what you already know and get you prepared to write objectives for the health fair.